The Birds here on 99.5 WSOS. It is 2 minutes now before 8 o'clock. A little bit of rain, especially around the southern end of St. Johns County, and we appreciate you being careful out there as you ride around. No major accidents to report around St. Johns County despite all the rain. The rain's going to end right around 2 o'clock this afternoon, and we should see some sunshine, believe it or not, around 3 o'clock, and nice conditions with temperatures close to 70 degrees, and that's Dr. Kalpana DePasquale kind of weather right there.
That's right. I like it a little colder, actually.
Do you really?
Yeah.
Yeah, you got your nice little sweater vest on today.
Exactly.
It's very pretty. Now you're going to have to take it off because it's going to be like summery by the afternoon.
That's all right. I can wear it for a little while.
Tomorrow it'll be pretty nice. Lots of sunshine with high temperatures in the mid-60s, and then a 50-50 chance of rain on Sunday with high temperatures right around 60 degrees. And then for Martin Luther King Day on Monday, temperatures right around 53 degrees. That'll be our high, so you can break out your parka, Kalpana, on that day.
I'm doing it.
Dr. Kalpana DePasquale is the founder of St. Augustine Ear, Nose, and Throat, and also the Avanti Medical Spa here in St. Johns County. 2 locations, one over on the island here in St. Augustine, and one, of course, in the Ponte Vedra Nice High School area off of US 1 North. And we appreciate her coming by on Friday mornings. She helps us play the music, and she occasionally brings along very special guests, which she's done that today. And we learn a lot, and we appreciate her taking time out of her busy schedule. Good morning.
Good morning. How are you?
So what are we going to talk about today?
Today we're going to talk about hearing loss and also hearing
I'm sorry, what'd
aids.
you say?
We'll get you in for an appointment. We will. We'll take care of you.
So I would think, obviously we play music from the late 50s, 60s, and 70s. So, our listeners are typically in their 40s, 50s, 60s, 70s. Yeah, I guess that's the prime age for hearing loss. Is that safe to say?
Yes, it is. Usually after the age of 50 is when we're more suspicious of hearing loss in our population.
Right. And do people sense that they're losing their hearing? Because I know there's a lot of, you'll see sitcom jokes and things like that where folks are not cognizant that they are losing their hearing. Is that a common problem?
It's a very common problem. I usually tell my patients that if you lost this much hearing overnight, you'd be running to my office begging me to fix it.
Right.
But the bottom line is because it happens so gradually over so many years, many people don't notice until it's gone too far.
Seems like one of the early indications, or that we even hear from our listeners, or I've heard from family members and friends, is the TV volume getting higher and higher and higher.
Yes. That is a very common occurrence.
Right. In this business, there's a couple of reasons we should go to some radio show or radio station conventions, but hearing loss would be one of them. You will never get a larger group of people together that are partially deaf than people that have been on the radio, because we wear these ridiculous headphones for like 30 years and keep them turned up way too loud.
Very true. Very true.
But there are other issues that can happen, right? I mean, when you think about St. Augustine and St. Johns County, who are what kind of jobs or what may have been things that people would have done in the past that probably and maybe even likely have led to hearing loss?
Well, there's the automotive industry. There's people who work around airplanes.
Yeah, Northrop Grumman, right?
Yep. I mean, the bottom line is, OSHA has requirements that they're supposed to provide hearing protection for these people. But I think that only started somewhat recently. So the people who are exposed to that kind of noise level maybe 20, 30 years ago before OSHA are definitely candidates for hearing loss. So they should be checked regularly.
I have a neighbor in World Golf Village who was the chief mechanic for Northwest Airlines back when there was a Northwest Airlines for 38 years. And we were actually talking about this just about 10 days ago, where he said for at least the first decade of his career back in the 60s, there was an option. There was a little box near where they'd punch in and out that had some earplugs. And that's
really?
all. And all day long, all he did was work around airplane engines. I mean, significant airplane engines. So.
Yes.
And as a result,
big hazard.
Yeah, as a result, if you're at a cocktail party with him, I was with him over the holidays, you have to stand right on top of him.
Right.
And then there's the issue, I guess, it's probably more of a guy thing, but the vanity about doing something about it, right?
I don't think that's just men. That's men
Really?
and women both. Absolutely.
Right.
They're very hesitant because of vanity.
Is there a gender break at all between men and women in terms of who's more likely to take the initiative and do something about it? Are men a little slower than women? We always like to pit the sexes against each other, and Dr. DePasquale never takes the bait.
I may have to defer to Rick on that.
Who's Rick?
I don't know. So Rick is my hearing aid specialist. He's been with me for almost 13 years since I opened the practice. So he does, once I determine a patient is a good candidate for a hearing aid, at that point I send them to Rick if they're interested in a hearing device. At that point, Rick will do the fitting and all the other details surrounding that. So that's a good question, because there are a lot of patients that I see that are good candidates, But at that point, I don't know how many men versus women are willing to do something about it. So I think that's where I'll have to defer to Rick on that one.
Rick, good morning. How are you?
Good morning.
Rick Silverman is with us, and he is a hearing specialist, and you've been around this issue for a long time, right?
Many, many years, over 25.
I would imagine, Rick, when we look at our cell phones and the advances that have been made just on that in the last 5 years, or we get into a car and we see how advanced it is, that in your business, there have been amazing advances.
Absolutely amazing. Over the last 3 to 5 years, the technology has changed so dramatically. In fact, the cell phone industry has been the recipient of most of the changes in hearing aids.
Oh, really?
Yeah.
Well, I'll tell you what, we're going to take a quick break. We'll come back and talk a little bit more about that, right? Dr. DePasquale is with us. If you have any questions at all about hearing loss and those sorts of issues, that's something, obviously, that they spend a lot of time on at Dr. DePasquale's offices here in St. Johns County. You can always connect with her by going to the website for St. Augustine Ear, Nose, and Throat by going to saent.net. That's saent.net. We'll be right back. Herman, and a little bit of help from his hermits here, and gives us an excuse to play all of our hearing theme songs. That's a good bubblegum chomping tune, right, Kalpana?
Yes, it is. I like it.
Yeah.
I like how all the songs are appropriate for what we're discussing.
That's right. We're going to be talking during this hour. If you're just joining us, we're talking about hearing loss and hearing aids, some amazing progress that's been made in that field. If you have some antiquated thoughts about the big old flesh-tone plastic-colored device that hung on the back of your ear that maybe your grandfather had, those days are long gone, right, Dr. DePasquale?
They are long gone. I mean, hearing aids are so high-tech now that you can't even see them. They work so well that people, the complaints of the feedback and all those things are almost gone at this point. So we have made tremendous advancements, and I think people need to be aware of how things have changed over the last several years.
Dr. DePasquale is with us, and of course, she is the founder of St. Augustine Ear, Nose, and Throat with 2 locations here in St. Augustine. You can always learn more by going to saent.net. Rick Silverman works with her as well. He is a hearing specialist, and we were talking a little bit before the break about, we've seen the amazing advances of cell phones, and indeed, back in the day when analog cell phones first came out, if you were in a construction zone or if you were driving down the road, it was almost impossible to hear that person on the phone. Now we don't really recognize it as much, but the reality is you can be on a cell phone in the middle of a construction zone and usually hear the person quite well. Well, that technology came from where?
The hearing aid industry.
There you go.
Yeah. Hearing aids have come a long, long way from the complaint of hearing and noise and so forth. The technology has changed pretty dramatically.
Help us understand, what does a hearing aid even look like in 2016? Because I mentioned when we first started talking about the old clunky plastic things that your grandfather or great-grandfather had hanging out of his ear. Those are gone, right?
Oh, pretty much. As Dr. DePasquale mentioned, feedback was a real issue. And to defeat that, we had to get this big device that sealed up the ear canal. Feedback's pretty much been defeated, so now we can just have a little bud that does not occlude the ear and really offers a nice natural sound.
Is there a certain level of hearing loss that someone should have before they get a hearing aid? I mean, when do you really need a hearing aid?
Well, I'm going to just interject here. The best time to intervene with a hearing aid is when your hearing has not gone too. It should be moderate. You don't want it to get to the severe point, because I've had patients tell me before, I'm going to wait till it gets really, really bad, and then I'm going to get a hearing aid. And honestly, that's not the right time.
Right.
Reason being is at that point, your hearing has gotten so bad, we can't really help you to the level of what we could have before. So it's just an important point. I hear that statement quite frequently.
So people, if they suspect hearing loss, or if their spouse or a friend or family member says, hey, I think you should get your hearing checked, do we still go and have these tests where these little beeps are sent into headphones? Beep, beep, beep.
Exactly.
Is it still that same
Still
way?
Still that way. And I have to tell you, I mean, I know it's kind of a nerve-wracking test because, did I hear something? Did I not hear something? But it's very necessary. I mean, I regularly get my hearing checked as well because I don't want to be losing any hearing. And I routinely send my husband in because I think he can't hear. So that happens also.
That might be a selective hearing problem.
It may be.
I remember back in the day, to me, it's almost like a competition. You want to be able to hear the most faint beep possible. It's
true.
like a measurement of your like hearing strength, and then when you look at the person who's administering the test, did I miss one?
Right.
Because then the anxiety kicks in.
Well, that's an important fact you bring up, because you do tend to want to look at the person administering the test, and a really good tester will have this straight poker face.
Oh, wow, really?
Because and that's, people have told me many, many times that they've had other tests done elsewhere, and they could tell when they missed something, and that, when they have it with Rick, they couldn't tell. So that's a true test. I mean, you don't want to be giving it away. I mean, you want to be poker faced. You don't want to give the answer away. And there's certain techniques that you can utilize to really assess their hearing, and I feel that Rick is especially good at that.
Rick Silverman, so you administer the test with the beeps that fade away.
Mm-hmm.
Yeah. And what's the secret to your poker face?
I play poker.
Oh, is that it? Oh, all right. Well, that makes sense.
But I think a really important point to make is most people don't have a problem with hearing. Most people have more of a problem with clarity and understanding.
Okay. So that's because, I guess, we hear, and then we also have the ability to hear with more precision, right?
Yes, and also most people's hearing goes more quickly in the higher frequencies where we get the consonant sounds that define words. So frequently we'll hear people mention, everybody's mumbling, they turn their heads when they're talking to me, they're talking to me from the other room. And so getting the sound is one thing, understanding the sound clearly is the other.
I guess that's too why we hear people that will pick up bits and pieces of a conversation, but they won't get the entire meaning of it.
Mm-hmm.
Interesting.
Yeah.
Rick Silverman is with us, and he works, of course, with St. Augustine Ear, Nose, and Throat. Dr. DePasquale is here live in the studio. Physically, you're the medical doctor in the room, by the way. I think you figured that out.
I think so.
Yeah. What's going on? What's happening? I mean, it's aging? What is no longer working that worked so well when we were 6 years old and on the playground and could hear everything?
So it's the inner ear, basically. The hair cells have started to deteriorate, and those are the little nerve fibers that basically detect hearing. So over the years, because of either age or genetics or noise, being around too much noise, these things start to deteriorate, and that's what causes the hearing loss.
Very interesting. All right. Well, once again, if you know someone in your circle of friends, family member, a spouse who you suspect is having a hearing loss issue or losing just a little bit of hearing, there's no harm in getting a test, right?
There is no harm in getting a test. At least we can find out what's happening.
Yeah, and if nothing else, you walk out of there with the peace of mind knowing that your hearing is fine.
I've had that happen where people said their spouse said their hearing is poor, and they go and post it on the fridge that their hearing is great.
The only downside to that is that you can't tell your wife or spouse anymore that you can't hear them.
That's true.
So
Pluses and minuses.
You can learn more and schedule one of these tests by going to the website saent.net. That stands for St. Augustine Ear, Nose, and Throat. Check out the website saent.net, and we have a link to that too. Also, we'll put that up on Facebook. So stay tuned. We'll be right back with Dr. DePasquale. Melissa Manchester, and you should hear how she talks about you. And Denise Williams, let's hear it for the boy. And so that Dr. DePasquale picking all the music this morning, demanding that we play music that deals with hearing because we're so literal here. We're talking about hearing loss and hearing aids, and Rick Silverman from St. Augustine Ear, Nose, and Throat is with us. And, of course, Dr. DePasquale, who's the founder of St. Augustine Ear, Nose, and Throat, is with us, as she is every Friday morning. Good morning, Dr. DePasquale.
Good morning, Kevin.
How are you?
I'm doing great. It's Friday.
So you say you have your hearing checked often. What's a good time? Like we get our teeth cleaned every 6 months. How often should we get our hearing checked?
Anybody over the age of 50 really should be doing it annually, especially if they have some sort of hearing loss that we've already identified. Now, I haven't quite reached 50, so I just do it randomly when I think it might be suffering in some way.
Yeah, Dr. DePasquale, a couple decades away from that milestone, but it will get here.
It'll be here.
Wait. One interesting thing, Rick was talking about this with us off the air, which is amazing, really, because I don't think this takes place with vision loss. The length of time that you start having a hearing problem and you actually do something about it.
It's amazing. 15 years. Can you believe
that?
Wow.
Yeah, because I know with vision, for most people, if you can't see the road sign on 95, Yeah, usually within a few months you're doing something about it. Most people, right?
Yeah, most people would. Yes.
But not hearing. Why is that?
I think there's a lot of denial when it's associated with hearing, and maybe it's just not as obvious that your hearing is compromised to some extent.
Yeah.
And the funny thing is, too, even after that 15 years that they wait just to get a hearing test, even after that, they may wait 3 to 5 years to actually do something about it.
Wow. So, Rick Silverman, they'll come in and you'll give them a hearing test. You will identify that indeed they've had hearing loss, and it may take 3 years for them to actually do something about it.
Many times people will put the decision off. The denial, as Dr. DePasquale said, is a huge factor. I've had spouses come in and question me closely, saying, well, they came home and said everything was fine.
Oh, wow. Even though you didn't tell them
Even
that.
though there was a pretty significant
So what's you're a good psychologist, even though you're not trained to be one, because you've been around a lot of people. Why do we do that? Because I think if I went to the optometrist or an ophthalmologist and he said I had a vision issue, I would share that with my spouse or whatever. Why do we not share hearing versus vision?
I believe that over the years, there's a social stigma against hearing aids, and that doesn't exist for glasses. I think that's the big issue. Bottom line, you need glasses, people wear glasses, and you know what? Young people wear glasses too, right? So, I think there's a very negative stigma that they don't work, they do a lot of feedback, they're unsightly. So all of these stigmas has been going on for so many years, and I think it's a little hard to get past those.
It's interesting because we all know that we don't have to wear Coke bottle glasses anymore, right, with the high-intensity lenses and all that sort of thing. But yet, I would imagine the technology with hearing loss is even more advanced than with vision loss, and yet we don't acknowledge that.
Very true. I was saying that the hearing aids today have 3 times the computing power of the computers that sent a man to the moon.
Wow.
Pretty impressive.
That is
we
amazing.
Can't say that with our eyeglasses.
No, clearly. How does it work, too? Like with eyeglasses, getting back to that, if my vision slips after 24 months, a couple of years, I have to get a new prescription. We're all familiar with that. Mm-hmm. With a hearing aid, you make the investment in a hearing aid, which may be and likely is more costly than a pair of glasses. When your hearing probably continues to decline a little bit, right, over time. Does it match with vision loss? The way we sort of progressively lose our vision capability. Does the same thing happen with hearing loss?
It certainly can. I mean, that's why we recommend hearing tests every year, just so we can see the slow progression or if there's a decline going on. But interestingly enough, unlike glasses where you have to get a new lens or whatever the case is every so often, the hearing aids can actually be programmed and adjusted to fit the hearing loss that you have if it's progressed.
Just like the volume on your cell phone, right, Rick?
Oh, absolutely. The technology, and I keep coming back to the technology, has gotten so advanced. When we fit the hearing aids, we use the computer to adjust them specifically for the person's hearing loss, and that can be done over many years.
Wow. So does it work like our TV remote? Like if we're in a really boring company meeting, we can just hit the mute button and just nod?
There is that capability,
wow.
Absolutely.
And there'll be just total peace and quiet and relaxation. That's a great thing, isn't it,
That
Dr.
might not be so
DePasquale?
bad, Not so bad.
Hey, we are learning a lot about some of the amazing things that are happening, obviously, with hearing loss correction with Rick Silverman. He works, of course, with St. Augustine Ear, Nose, and Throat. Dr. Kalpana DePasquale is with us. She's the founder of St. Augustine Ear, Nose, and Throat. So when you use that little device with the light on it and you peek in somebody's ear, can you tell pretty quickly whether or not they might have some hearing loss just by physically looking at them?
Not necessarily. The type of hearing loss that we're really going into detail about today is sensory neural hearing loss. So often the ear looks perfectly normal. So that doesn't tell us how it works. Now, of course, there are people who come in with infections or wax or some other problem, and those are easily identifiable by physical exam.
Right. I was wondering what you do when you have that little thing with the light.
I just close my eyes. No, I'm kidding.
It's funny because I don't know about the rest of our listeners out there, but when a doctor, certainly an ear, nose, and throat specialist like Dr. DePasquale, breaks out the little thing with the light at the end of it and sticks it in your ear, there's like this period of anxiety. Do you know that? I mean, I'm just telling you on the part of patients. Mm-hmm. We don't know, and yet nothing horrible usually is found. I mean, that's probably one of the least likely bad outcome sorts of situations. But there's something about you guys pulling that thing out of your little jacket pocket and turning the light on. Does it work like that? Like when you do that with your sons? Do they get any anxiety at all?
No.
Do you have one at home?
Well, yeah, I have one at home and carry it around with me just in case. You never know.
All right. These are the kinds of things we want to know from Dr. DePasquale. See, Rick, we pull little tidbits out of her all the time. Hey, we're talking about hearing loss. If you have any questions at all, would like to schedule a consultation, we encourage you to do that by starting out with the website, saent.net, saent.net. We'll be back with Dr. Kalpana DePasquale and Rick Silverman in just a moment. Stay tuned. That's the way I've always heard it should be. Carly Simon, the woman who did the ketchup song, Dr. DePasquale, Anticipation. They're holding the Heinz bottle upside down and you're waiting for the ketchup to come out.
I never do well with that for some reason.
You don't remember that commercial?
No.
Bonnie Hayflick's here. She remembers that commercial. So maybe Rick does. Rick, do you remember the commercial?
Absolutely.
So this is the age problem, when you have a youngster here in the house. Oh, man.
I know nothing of what you guys are even talking about.
It makes me feel really old. Dr. Kalpana DePasquale is the founder of St. Augustine Ear, Nose, and Throat, and we appreciate her taking time out of her busy schedule on Friday mornings to come and help us play the music between 8 and 9. We always learn some stuff, and that is certainly the case today, and she brought along her colleague, Rick Silverman. He is a hearing specialist who works with her in the practice, and we're talking about hearing loss and hearing aids in 2016 and how there's been some pretty darn amazing progress, right, Dr. DePasquale?
There really has. And I think I was telling you in the break that I'd much rather wear a hearing aid than glasses. Just at least I can hide those hearing aids, but the glasses, not so much.
Rick Silverman, tell our listeners, what does a hearing aid look like in 2016?
The most common prevalent instrument is what they call a RIC, surprisingly, but it's RIC.
Works for you.
Yeah, and it stands for Receiver in the Canal.
Okay.
And it's a little device that sits actually on top of the ear. It has a very thin tube which it conceals a wire down to the receiver, which is placed in the canal, which is actually where the sound is generated. The clarity is wonderful. It's a non-occluding little bud, very comfortable to wear. After a couple hours, you hardly know it's in your ear.
How much does it weigh?
Oh, negligible. You'd never know that it was on your ear.
Wow. And once again, we want to encourage people. There's so many people out there that will wait way too long to get one, right, Rick?
Unfortunately, yes. And the other unfortunate part of it is a hearing aid is not going to exceed a person's capabilities. And many times people think, oh, I'll wait till it gets bad, like Dr. DePasquale was saying, and then I'll get something and I'm going to do great if I spend enough money.
Right.
And unfortunately, it doesn't work that way. If a person's impairment limits them, the hearing aid is not going to exceed that limitation.
This is pretty cutting-edge technology, though, right, Dr. DePasquale? And obviously people can go to Walmart, they can go to Costco and get one, or they can be professionally fitted for one. But this is the kind of technology that you probably don't want to go to Wally World to get.
Probably not, just because, this is something that's very personal. And, you can have the same hearing loss and the same kind of hearing aid, but it's really all about the adjustment that makes all the difference. You want somebody to be able to spend the time with you and give you that personalized care so that they're determining what situations are problematic, what is the problem, what would you like better. And, a lot of times those bigger institutions really don't have the time to cater to your needs.
Right. We talk about, of course, you get fitted for eyeglasses, and, you can quite honestly probably go to Costco and get fitted for eyeglasses. But this is technology that has a lot of different adjustments, has a lot of different requirements, right, Rick? I mean, you really don't want to just trust just anybody to put a hearing aid inside of your ear.
Absolutely. It's not something you just get and walk away. We like to see our patients on a 3-month basis to clean the instruments, check their ears, make sure everything is working well. But again, the technology also allows us to download updates into the instrument and improve their functionality over time.
Dr. DePasquale, when someone gets their very first hearing aid, so what are they going to experience? I mean, is it going to be just some dramatic change in their hearing? I mean, how do they normally react when that happens?
Psychologically, I think it's so it's so amazing to me watching the transformation from the patient who came in with that hearing loss to after they come in and have had a couple of visits with Rick and they've had a couple of adjustments. And many times you see this person who seems very introverted, and next thing you know, they're laughing, they're joking, they're just a whole different person. So it really can change their outlook on life, their interactions, their sociability, everything.
Rick Silverman, I would think that you see that often in working and fitting patients at St. Augustine Ear, Nose, and Throat with hearing aids, because even the most outgoing person, maybe in their 30s, 40s, and 50s, can become introverted, because if you can't really hear what's going on in a conversation, you can't really participate in it.
Absolutely. It is incredibly gratifying when patients come back, and I can think of one gentleman in particular who I saw in a social situation, sitting in the corner, smiling, nodding, acknowledging people. But after he got his instruments, he was the life of the party. He was, joking and smiling and laughing. Not infrequently, we will have people have tears in their eyes when we fit them with their first hearing aids.
Right. And that's what I guess I was getting at when they first turn it on, because like you said, odds are, unfortunately, it has probably been many years that they could have benefited from a hearing aid. They waited. Obviously, the issue has gotten even more severe, and then they finally fix it.
True, although most hearing aid fittings are not like throwing a light switch and they don't hear and then they hear. We normally start them less than their targets would require and then bring them up over time. So it's not quite as big a jolt.
Okay. That's interesting. Yeah, so there's, and that points to why you don't want to just go to Walmart to get one.
Right.
Because
I
there's a thought process here.
There is a thought process, and it's a real personal experience. I mean, you develop a relationship with these people. You're seeing them frequently. I mean, it's funny when I see the patients for another reason related, whether it's wax removal or something else. They are, are we going to see Rick today? Are we going to see him? And I like to see that. It makes me... I know that they have a good relationship when they're excited to see him about getting their hearing aids adjusted or checked or whatever it may be.
Well, very good stuff. Hey, when we come back, we're going to get to sort of the nuts and bolts a little bit. We'll talk a little bit about affordability. We'll talk about warranties and all that kind of stuff, different options, how you would go about moving forward. So stay tuned. The Beach Boys, and I Can Hear Music, and that's probably one really good reason to get a hearing aid, right?
I agree.
Or to be tested for hearing loss.
Yes, you don't want to miss great music. That would be terrible.
Dr. Kalpana DePasquale is with us from St. Augustine Ear, Nose, and Throat, where they can test you for hearing loss. What's that process like? I mean, how does it start?
Well, it starts with, obviously a good history if you're saying that you have some issues hearing. And then at that point, we would do a complete physical exam, make sure that the ear canals are clear, that the tympanic membranes, the eardrums look fine. And if everything checks out okay on the history and the physical, there's a concern for hearing loss, then we move on to the hearing test. At that point, you're in a soundproof booth with some headphones, just like what we have on right now, and you hear some beeps, and it takes about 30 minutes or so, and then you're done. Pretty simple.
Do you get the results right away?
Yes, you do.
Wow. And then you make a decision from that point moving forward. Mm-hmm. Rick Silverman is with us. He works with Dr. DePasquale at St. Augustine Ear, Nose, and Throat. He's a hearing specialist. So do people have options? Obviously we can go and pick out different types of eyeglasses. Do we get to, if we have a certain degree of hearing loss, are there different models of hearing aids we can select from?
Oh, absolutely.
Yeah.
And once a person has a hearing evaluation, we talk about the issues that they have, and then we pick the most appropriate instruments.
And, of course, from that point, we then move on to affordability, right, Dr. DePasquale? And, it is important. This is amazing technology. It's certainly more sophisticated than a pair of glasses.
Correct.
So it's going to cost more.
Well, we have hearings that will fit everybody's budget. So as Rick said, after talking to them, finding out exactly what their needs and their requirements are and what their hearing demands are, because you have a different kind of person that maybe somebody who doesn't go out a whole lot may need a different kind of hearing aid than the person who's really running around working, running a company or something. That may be a different demand. So based on what they need, we can find one that's affordable and that fits into their budget. And we also have payment plans available too.
Just to try to figure that out, Rick, in terms of models, is it just sort of a B, or C, or is it just a plethora, a whole bunch of models, or what are we looking at?
Basically, there are the ITE, which is the instrument I think most people are familiar with that fills up the whole ear, the concha area. There's the BTE, behind the ear, which is the large device that sits behind the ear. The ITC, in the canal, a little smaller.
Right.
CIC, completely in the canal, which is the small one. And now we have what they call an IIC, which sits down around the second bend, completely invisible, and nobody can actually see it.
That would be Dr. DePasquale's.
That would be mine, yes.
Man, unlike the government, don't they have the best acronyms? I mean, the acronyms actually make sense.
That's true. They do make a lot of sense.
Hey, before we let you go, let's address the issue that some people may have in their family or their circle of friends, and that's tinnitus. Right?
Yes, tinnitus is another thing that we see quite a lot of. People have ringing in the ear or some noise in their ear. And what's really great now is we have technology that can address the tinnitus even if you don't have a hearing loss. Used to not be that way. They almost had to have a hearing loss for us to be able to really effectively help the tinnitus.
Okay. Well, obviously, if you've been told that maybe you have that issue or that is a possible issue, somebody's been surfing a little WebMD and you want to find and develop that a little bit more, Dr. DePasquale is the person you should sit with and get a consultation with, correct?
That is correct.
Yeah. On any of these hearing loss issues, try to encourage your friend, spouse, or what have you to go get a test. Sometimes the results are fine, right, Rick?
Absolutely. And it gives us a baseline. God forbid something happens in the future, we can refer back to see and have a comparison again.
It really is similar to going to get your, to seeing the dentist every 6 months, right? You go and you hope, and odds are oftentimes you go and you don't have any cavities.
That is absolutely correct. But people are much more willing to go to the dentist, go to the eye doctor, get their blood pressure, cholesterol checked, but they're not so willing, unfortunately, to get a hearing test.
Well, hopefully we made some tiny little step in the right direction on that today.
I hope so.
Dr. Kalpana DePasquale, thank you very much. And Rick Silverman, thanks for your time. Thanks for coming on the air. And Dr. DePasquale, we will see you and hear you again next week.
Sounds great. Thanks.
Right. Any other questions, make sure you check out the website, saent.net. That's saent.net. It's 5 minutes before 9 o'clock, 66 degrees in downtown St. Augustine, going up to 74 today. Hang in there. We'll see some sunshine after lunch, but up until lunch, about an 80% chance of rain throughout St. Johns County.